We cannot really diagnose Zika infection based on symptoms alone, as most people who are infected do not show any symptoms or the symptoms are very mild. It's estimated that 1 in 5 infected individuals would show symptoms. And in those who show symptoms, they are fever, joint pain, a rash, which is really very generally considered as a flu-like illness and is not enough for us to really say that the cause of the infection is actually Zika, due to Zika. Right now, we have 2 types of tests that could help us with the diagnosis of Zika infection. One is to detect virus, and since the virus is only present in blood in the first 5 days after onset with symptoms, they could only be used during that time period. The other is to detect antibodies in blood in response to the infection, and that typically can be used around 6 days after infection.
So Zika virus can be diagnosed and detected directly using a polymerase chain reaction or PCR test. This is a common test that we use for dengue virus as well, but the primers can be very specific to Zika virus. Unfortunately for Zika virus, the presence of the virus itself is difficult to recognize. The symptoms, clinical symptoms, can be pretty mild in the majority of people. And unlike dengue, where you get a very clear fever, which often signals the viremic stage, for Zika virus, this can be difficult to detect. And with the virus being present in blood perhaps just a few days, actually getting the chance to isolate the virus or detect the virus in those samples can be very difficult. We know that Zika actually can be detected in other samples such as urine and semen, and this then offers perhaps a longer window of time where we can do a diagnostic test. However, pinpointing that time can still be very difficult, and so typically we rely on the antibody test, the indirect measurement of the response to the infection as a way of actually diagnosing it. So Zika is actually very similar to dengue virus. It's not only transmitted by the same mosquito, but it's also genetically similar, and it actually in particular has a similar envelope protein, which is so related to the dengue viruses that it makes it difficult to distinguish them in many ways. This similarity causes problems with the detection, because antibodies that raise against dengue virus can also cross-react then with the Zika virus, and this is causing the communities a lot of difficulty in recognizing what actually was a Zika virus compared to a dengue virus.
Right now, the situation is very difficult because without good tests that is accessible to definitely diagnose infection, we cannot make the association between, say, pregnant women who's infected and if their baby is born with microcephaly. The other is that we usually use antibody-based tests to try and look at the extent of the outbreak in a country. But since these antibody tests are cross-reactive and could be false positive or false negative, we don't have a tool to assess the extent of the outbreak.
The similarity of that envelope protein, it makes the not only diagnosis difficult, but potentially a vaccine difficult as well. For dengue virus, there are 4 separate viruses, and people have known for a long time that you need to make a vaccine against all 4 of those viruses, because if you fail to make a good antibody immune response, neutralizing protective immune response against all 4 of the viruses, then you might end up with what's called antibody enhancement. That's where the antibodies from one virus, instead of protecting you, might lead to enhancement with a different virus. While we don't know yet whether Zika virus actually does cross-react sufficiently to enable this antibody enhancement procedure to occur for Zika virus, it's a good likelihood that it will, based on our diagnostic problems. And if that's the case, then we need to make a vaccine that protects you against all 5 similar viruses, the dengue viruses and the Zika virus, in order to make sure that you don't suffer from this enhanced disease. And we don't know yet whether Zika can enhance dengue or whether dengue can enhance Zika, and all of these things making a vaccine quite complicated.